Hi, I'm Elizabeth Hess. I'm here with the administrator of the Champaign-Urbana Public Health District, Julie Pryde. Hi, Julie.
Hi, how are you?
I'm doing okay. Since we talked last, students are back. They're back in school. Let's talk about the numbers in Champaign County. Where are we now?
Well, as of this morning, we have 504 active cases. That means 504 people with COVID who are in isolation, probably 5 times that many in quarantine associated with those cases. We have 2 hospitalized right now. Our total number of positive cases in Champaign County cumulative has been 2,369. And thanks to the U of I's testing program, our county has done an astonishing 230,328 COVID tests.
Is that a number that makes you comfortable with this influx of students? Where's your comfort level? That's how I'll gauge mine.
Well, my comfort level isn't necessarily with the numbers. We're more interested in, because anyone can bring it in, and then the U of I is testing everyone twice a week and then putting them in isolation, and then we're contact tracing and putting everybody in quarantine that's been associated with them. What we're looking at is what we always look at, the positivity rate, and what our low positivity rate shows is that the U of I is doing a ton of testing, and that will keep feeding them over to us and letting us know if we have any outbreaks or clusters. If we start seeing that, then there's going to be, an issue. We've seen a little bit of that, but most of the cases were, what we would call imported, meaning they moved here with that. We will also be looking at, continue to look at the hospital capacity. And, the main thing is we just don't want these cases. We can't do anything about the initial cases when they come here, but we don't want them to start spreading around.
What have you heard about campus and mask wearing and social distancing? What's the word on the street?
The vast majority of people, if you go to the U of I, you can drive through there at any time. You will see people wearing masks and distancing and doing what they're supposed to do. What concerns us are those who, and you're always going to have them, even though the vast majority of people are doing what they are supposed to do, to make sure that they can remain down here and we can keep the school open. There will be those who will have parties and sneak around and not follow guidance and not do what they're supposed to, and they will jeopardize the entire thing. So, I know the U of I has a lot of mechanisms in place. They can suspend people. They can do all kinds of things that we don't do, in the general public, including their mandatory testing twice a week. So, they have a lot more control measures in place. So we'll just continue to work with them and keep an eye on this. We're about 2 weeks in, so we have to keep, now we're going to keep an eye on it to make sure that we're not starting to see, spread through parties. It'll be through parties and gatherings, just like it is in the general community.
So the University of North Carolina or South Carolina and Notre Dame, they went back for a week and shut down immediately. Mm-hmm. Alabama now has 1,000 documented cases. Where is Illinois on that spectrum?
Well, right now, I don't know how big Alabama is, but, the University of Illinois, there's a lot, around 40,000, students, faculty, and staff. And we have a total in our entire county right now of 504 cases. So they're nowhere like the other places. The problem with the other universities trying to open is they just don't have the testing capacity. Testing is key because it lets you know all the time what's going on, and you can start seeing if there are clusters or if there are outbreaks, as opposed to the initial. You can't do anything, like I said, about the initial ones coming onto campus from home, especially if they don't feel sick when they first get here. So the other ones just did not have. I think that they just tried to throw the doors open and give it a whirl and see what would happen. Not really the best the best idea, but they did do it. But if U of I, if they can't do it, then I believe there's no place in the country that will be able to do it, because they do have everything in place. So if there is a way to keep a university open during a pandemic, that will be the example.
Lots of research being done right now for a vaccine. I keep getting texts from people saying, I hear that they're in the third trial of the vaccine. Can you walk us through the general process of when people are testing a vaccine, what that means and what each stage means?
Well, what they want to do is get to the phase 3 clinical trials where they will be looking at it. That's where a lot of people can volunteer to get the vaccine. Or I'm not exactly sure how they're doing it. There are so many vaccine um, candidates out there right now. But what they're doing during that phase 3 thing, and that is a really important piece of it, because they're showing if it's safe and effective. So you do not want to put something out there that is not safe, or that is less effective than it is safe, like what happened during 1976 swine flu mass vaccination campaign. That was not a good campaign. That was not effective. So you just have to wait until it gets to that point. But in the meantime, it's not like health departments are just sitting here waiting for a vaccine to come along. We're gearing up and getting ready for when we have to do a community-wide vaccination event, which takes a lot of planning. It takes a lot of thought and practice and things that we've done in this community together with our partners for years. But they really do have to go through um, the phase 3 clinical trials to make sure that it is safe and effective, because if it isn't, you don't want to use it.
Would you personally sign up to be a, for lack of better phrase, guinea pig in a trial run?
I already have.
You
I,
have? Tell us
I
about
did. I
that.
signed up about a month ago when NIH first put out the call for volunteers. What they do is they cast the net super wide and ask you, just kind of a bunch of general questions, and then you will get thrown into the pool of it. And there's a lot of things. I sign up for a lot of different clinical studies. I think they're important and they need people in them. But whether you get picked or not is a whole different thing, and where they're doing it. Like, let's say if Carl ends up being one of the trial sites, then you would do that. I would do that, or OSF, or whoever ends up doing it. But if I were to be picked, yes, I would do it.
Influenza doesn't have a booster. It's one shot per year, yet HPV has one and then a booster. Is there a possibility? I'm hearing rumblings that COVID could have two shots in this process. Have you heard anything about that?
Yeah, and it is quite possible. Some shot series, there's all kinds of different things. This is what isn't known. Like your tetanus, diphtheria, pertussis shot, you get that every 10 years because immunity wanes. Flu shots you get every year because immunity wanes and because the virus changes. We don't know what we're dealing with this yet, and how often we may need it. It may need to be something like a flu shot that you have to get every year or every few years. But also, even with a novel flu shot, or the first time a child gets a flu shot, they need 2 doses as well. So that's not really an uncommon thing when something is really new.
Let's talk about misinformation. You and I both know that you need to know the source to see if you can trust the source. And there's a lot of misinformation about the CDC saying death rates and what are they putting on death certificates. 6% of COVID cases are listed as COVID alone.
Yeah.
Can you clear up some of this misinformation?
Yeah. So during COVID, all of a sudden, people are starting to pay attention to reports and things that are out there all the time. Unfortunately, they don't really pay attention to it. They don't read it, or they don't read it and understand it, or they just read a meme about it or someone's tweet about it, which is completely false information. And because they link it to CDC, it's I guess they think it gives it some more authority. But the fact is that the information that just came out from the CDC is nothing new. It is talking about, we say this all the time, the vast majority of people who die of COVID have underlying health conditions. So what they're saying is, of the death certificates, only 6% listed COVID alone. That's still a lot of people that just have COVID alone. But I can tell you, as you know, most Americans most American adults, not children, but most American adults have some kind of underlying health condition. When you consider, Obesity is an underlying health condition. Hypertension or high blood pressure is and diabetes. Those are all underlying health conditions. But on a death certificate, this is where all the confusion comes in. And again, people just like to go to their corner and try to use this information to, prop up their point, which is often not a correct point. So the deal with the COVID death certificates is, on a death certificate, it is rare to have one thing listed on a death certificate. It just is rare. When you die of COVID, for example, you're not dying of COVID necessarily. You're dying of acute respiratory distress syndrome, ARDS, caused by COVID. You're dying from pneumonia caused by COVID. You're dying from, kidney failure, sepsis or something. All these things can be, you have multiple things on a death certificate. So to say that only 6% of death certificates only list COVID is not at all surprising. That is nothing new. And that does not mean that we still don't have 180,000 Americans dead of COVID. Even if it's a contributing factor, the point about that is, if you hadn't had the COVID, you wouldn't be dead. It's like that was the thing that kind of pushed your other condition over into a critical stage.
What would the point or what would the benefit be of downplaying then? Why would people want to follow these conspiracy theories and say that, well, they didn't just die of COVID? Because lots, like you said, a comorbidity, they might have died of something else. They happen to have COVID. 6% is still a lot.
Well, Elizabeth, I literally don't know what's going on anymore right now with what people post and think all the time. There is just a whole lot of craziness going on right now that makes no sense. People will get on Facebook or get on something and argue about something they have absolutely no idea about. Why? I don't know. It is a scary disease. And the fact is, there are 180,000 Americans dead from this in less than a year. And it is something to be very, very concerned about and taken very seriously. Some people just refuse to do that for whatever reason. I don't even know.
A large number of the people that we have lost to this virus are minorities. This seems to have taken a back seat in the media, that it was talked about a lot at the beginning. Minorities are still dying at a disproportionate rate from this virus. Is that true?
It is, and they often die of a disproportionate rate of all kinds of things due to all the issues that we talk about in public health all the time, the social determinants of health, the fact that a lot of times people in minority communities have less access to health care. They have less access to, healthy foods, to safe places to exercise, everything, all the different housing, everything contributes. And, pandemics do shine the light brightly on all the health inequities that we talk about in public health all the time. Just now, other people might be seeing them. But the fact is, people may not know they have an underlying health condition because they don't go to the doctor. You don't know that you have hypertension or diabetes or anything else unless you go and have that diagnosed. So if you're a person who's not accessing healthcare because you can't afford it, because you can't take off time to get to the doctor, because you just don't have access, you don't know that you have these things. So it just like anything else, it makes it more there's more inequity involved in COVID, just like there is with all the other types of things that we deal with.
So the media may not be talking about it, but it's always prevalent on public health's mind.
It is. It absolutely is. And it should be being talked about more because, when we come out of this pandemic, this is one of those things that really, really needs to be addressed because it's shining the light on it. Just the fact that most people who have insurance, it's tied to their job. Well, when you have record unemployment, now all of a sudden people don't have access to healthcare. Are you going to go in and get a physical, or are you going to go in and get preventative care for other things? Or are you going to go in and get your COVID, symptoms looked at, maybe when you're having trouble? Maybe not, when it could bankrupt your entire family. And that's just the sad truth of it.
There was a 25-year-old man, as if I didn't have enough to worry about, in Nevada who tested positive in April and then tested negative, and then again a month later tested positive again. Is that something that you've heard, that we can be reinfected?
Well, it is something that they're looking at. I mean, it's still, the science is yet to catch up with this virus all the way. So, I mean, it certainly is something that is possible. Um, it is. I mean, there's no guarantee that this is going to, that we're going to get immunity after we're infected, which is another reason why we keep telling people, quit acting like it's not a big deal. We don't know. You might get it once and be fine. You might get it the next time and have a really serious case. We don't know. It's nothing to mess with.
We've talked about many times that as we go into the cold months, it will drive more people inside. That worries both you and I a little bit more. I'm thinking of voting early in person instead of by mail because of all of the drama surrounding the post office. Is that a bad idea, to go into a poll place and do it in person?
No, it's like anything, public health. What we're going to do is try to tell you that this is the safest, which would be voting by mail or dropping it into a drop box, all the way to, voting on the day during the busiest time at your polling place. So in between there is voting early and getting to the polling places when they're not as busy. Definitely it could be done safely if there were enough resources to do that, but you're relying on everyone else to do what they need to do as well. So you need to make sure that people at the polls are staying 6 feet away from each other and wearing masks. You don't always get that when you go to a store. So, we would like to think people would do it at the polling places, but we don't know that. So everybody needs to make their own individual decision about that. But the safest as far as COVID is to do it by mail or to get the mail-in ballot and drop it in a drop box. And the next safest would be going early when it's not busy. You can call ahead to some of the polling places and go in there when it's not as busy of a time. And then probably the least safe would be to go on the actual election day at some of the busiest times where you're waiting in line for a really long time.
Coming up on the fall, in addition to flu season, as the farmers harvest the crops, we have a house full of fall allergy sufferers. How can we differentiate our symptoms from COVID to allergies?
Really testing. That's the only way you're going to really know, because for some people the symptoms are really mild. So that's really the only way you're going to know. Now, if it's something that's unusual, if you always get allergies at the same time every year and it seems like you're having the same type of thing, then you can probably assume that that's allergies. But the only way you're really going to know is to test, because this virus has such a range of symptoms that that's really the only way to know.
Okay, last question before I let you go. I've been meaning to ask you this, but I want to know the answer. I don't want to know the answer. You keep saying older adults are at higher risk. What's the threshold for older adults? What's that age?
Well, they usually say 60 and over, but part of that is the older we get, we tend to get more underlying health conditions. Not everyone, of course, but it is a general rule of thumb. So that's part of what that has to do with too. But one thing I can say about our community, if you look at our number of cases, older people, 50 even and older, are doing a wonderful job of staying, socially distanced and protecting themselves and protecting others. They're doing a really good job. And, that has to be attributed to our lower fatality rate that we've seen in other parts of the state. I mean, people are really taking this seriously and staying away from others and wearing the masks. Every week that goes by, if I go out on the weekend, I'm happier and happier to see how many people are really taking this seriously and protecting others when they're out at stores or in the community. So
A huge compliment to your staff one of our scouts tested positive for COVID, and someone had to call your hotline, and the young lady on the phone was so helpful. She acted as if she hadn't answered the questions 5,000 times already that day. And she told us all, you should all get tested. Get tested. That's the key to it. So whatever message you're putting out there, you're all on a unified front. And she was very, very gracious. So thank you for that.
Yeah, we have a lot of staff working on contact tracing now. I think we're up to about 60 different staff who just are working on contact tracing and case investigation, and they're doing a great job. They are really doing a great job. That's another good thing about this community. When you need to, you know, put out the call and hire in people for all kinds of different jobs. And this is not, you know, a particularly fun job, but we didn't have any shortage of people stepping up and coming and taking these jobs. So we're happy about that too.
Thank you for that transition, because you know who else is doing a great job? Our producer, Jason Liggett.
Always.
Always. The Urbana mayor, Diane Marlin, she's fantastic as well. And Julie Pryde, there aren't enough adjectives to describe the job that you've done, but as the administrator of the Champaign-Urbana Public Health Department, I know we're in good hands. Thank you so much.